And then, in terms of risk factors for suicidal behaviour, the most common risk factor for suicidal behaviour is a mental disorder. The most common mental disorder associated with suicide is depression. And the second most common disorder is a substance use disorder, and the most common substance use disorder is alcohol. And so it's useful to remember that when people are, I got distracted. When people are young, that's the age at which mental disorders start to emerge. So 17, 18 is when we start to see substance use disorders really taking hold, depression, that's where psychotic disorders start to emerge with the first episode of psychosis. Other disorders such as ADHD, for example, are clearly apparent at 7, but for many of the mental health disorders, they start to emerge at the very age at which we have young people struggling with what is the world all about. So, talked about depression, bipolar disorder, the mood disorders, but I really want to talk about the impact also of substance use disorders and their contribution to suicidal behaviour. So alcohol misuse is the second most common risk factor for suicidal behaviour, and any substance, any of the opioids, cannabis, any drug also increases the risk of suicidal behaviour. And alcohol and drugs can make an independent causative contribution to suicidal behaviours, but they can also occur on top of mood disorders and all of the other background and contextual factors that are going on. So, and if the alcohol and drug disorders or drug misuse occurs on top of mood disorders, that really just exacerbates the problem for young people. So I've covered off, I think, some of the contextual factors, the very strong role of mood disorders and other mental health disorders, anxiety disorders as well, and of substance use disorders. The other contributing factors are if someone has made a suicide attempt previously, then essentially they've had a rehearsal or some practice, and it's easier to make another suicide attempt. They've faced off death once, it's easier to do it again. So in that respect, having a history of having made a suicide attempt makes people more at risk of making another attempt compared to someone who's never made a suicide attempt. Another pathway to suicidal behaviour comes from a family history of suicide. So if there are members of a young person's immediate family, parents or siblings who have made a serious suicide attempt and survived it, or who have died by suicide, then the young person is approximately 4 times more likely to make a suicide attempt themselves. And often the strongest contribution to that family history comes from a shared genetic history for the mental disorders with which suicide is strongly associated. But there's also a little bit of a modelling effect, so that if your dad died by suicide, for example, it makes it more available to you as an option, more understandable as an option. If your big brother died by suicide, again, it lowers the threshold and it makes it more acceptable for a young person to do the same behaviour. The strongest contribution, however, comes from the shared genetic contribution. The other things that can influence and lead to suicidal behaviours are bullying, and cyberbullying has had a lot of attention recently, but face-to-face bullying still occurs, workplaces, schools and so forth. while you can get some respite from face-to-face bullying when you go home at night, cyberbullying is different in that it's there 24/7. And it really does have a significant contribution to suicidal behaviour, particularly in school-aged children who may not fully understand the impact of the bullying behaviours. Social media, again, has an influence, and that's a relatively new contributor and causative factor to suicidal behaviour. We know that young people who spend more time on social media tend to have a higher risk of suicidal behaviours. The other factor that I have to mention is the availability of the means of suicide in the home. So if there's ready access to highly lethal means, and you have an emotional young person, for example, then it's very easy for them, ready access to highly lethal means, make a suicide attempt. I'll talk one more thing about alcohol. I do, because New Zealand does have a youth binge drinking culture, and there's no doubt that alcohol is one of the factors that contributes to New Zealand having the highest teen, male and female suicide rates amongst 43 developed countries in the world. Alcohol makes a very significant contribution to that. And the problem is that when someone is intoxicated with alcohol, they're disinhibited, they are more likely to behave impulsively and aggressively and to do things that they wouldn't do if they weren't intoxicated. And that includes making suicide attempts, but it also includes doing things that they humiliate themselves with, and then intoxicated think they can't get themselves out of that situation, and they catastrophize and will end up making a suicide attempt because they're not in the headspace, if they're intoxicated, to extricate themselves sensibly from a situation. So I've covered off a lot of risk factors, but as I said at the beginning, suicide is a very complex issue and multiple pathways, and it's usually not one single risk factor that contributes to suicide. It's usually a number of risk factors.